We're all about facts, not fear here, right? And giving you all the information to keep you and your loved ones safe. Well, we do that with experts, and we do that with, cherry red with a black trim. Fabulous, darling. She goes, Dr. Payal Kohli joins us live. Let's get straight to it. The CDC released new guidelines about swimming pools, and summer's coming up, so we need to know, is there evidence that the virus can be spread to people through water? Also, we want you to check out the recommended guidelines. Wear a mask when you're not in the water, stay 6 feet apart at all times, and don't share goggles or other gear. Dr. Kohli, is it safe to go to public pools now?
So, Tori, pool weather is definitely coming, so a really important question to ask. So let's talk about the science. In terms of the actual water itself, the chlorine and the bromine are very likely to inactivate the virus. So the risk of transmitting the virus through the water is very low. But as you can imagine, we behave differently when we're at a pool. We run around barefoot, we touch everything, we don't wash our hands quite as often, and we congregate because the pool is usually a closed space, and so a lot of people are in a close proximity to each other. So those are the considerations to keep in mind. Is really, are you able to follow those CDC guidelines at the pool? Are you able to maintain that 6 feet of distance or more? Are you able to wash your hands frequently, not touch too many surfaces? And keep in mind, the CDC wants you to wear a mask when you're not in the pool. But if your mask gets wet because your face is wet because you just came out of the pool, it actually doesn't work as well, and it also makes it harder for you to breathe. So some of these are, in theory, great guidelines, but in practice, they may be a little more challenging. So my advice would be, if you're high risk, stay away from the pools this summer.
Marquita Baker,
I'm sorry to say that, but it has to happen.
Marquita Baker just wrote, I ain't getting in no pool. Appreciate that, Marquita.
Yeah, because some people use the pool as a bathtub as well, so keep that in mind. But we also want to talk, So we also want to ask you about
or a bathroom.
Okay, so we want to ask you about our most vulnerable population, senior citizens. We keep hearing stories like that in Ohio, where nursing home patients make up 70% of total coronavirus deaths. Why are nursing homes such high-risk places?
It's a really important question. This is our most vulnerable population, and it's estimated that more than half Americans over the age of 65 will end up in a nursing home at some point in their lives for a brief period. So let's talk about what happens in nursing homes. This is a place where people live and work together, and the population is older or chronically ill, and they tend to congregate. You know, lunchtimes are done together, they watch TV together, they play bingo together, so social distancing is really hard. If one of them gets sick and is not sick enough to go to the hospital, they can't be quarantined, really, because they live there, and a lot of the other residents are living in close proximity to them. And then the employees who work there have to go from room to room, which can certainly spread the virus. And also PPE has been an issue in the nursing home. So I really think of it as the perfect storm of factors. And in fact, nursing home in Washington was called ground zero for this pandemic, which I think is so dramatic because it really shows kind of philosophically just how much impact a nursing home can have on the spread of the virus.
Wow, good information on pools and nursing homes. Guys, keep writing us in. Thank you, Dr. Kohli. Miss Cherry, you'll be back tomorrow, of course. If you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. There's no panic, just prevention and precautions and a little Cuomo.